With China's ongoing economic development, rising personal wealth, and an aging population, new health challenges have emerged. Changing lifestyles and environments have led to a greater prevalence of disease. The question is, deepening the public's awareness and demand for better health. Technology is driving innovation in health management, prevention, and digital transformation.
Today, we're splitting into two teams for the screening. Our main focus is conducting breast cancer screenings right here on site.
Here in Guangzhou, China, a screening program for breast and cervical cancer, a joint effort by iCare 365 Technologies Corporation and local healthcare centers, is in full swing. In line with the 28th National Cancer Prevention Week, April 15, 21, Thema Cancer Prevention, Early Action. The campaign encourages everyone to take charge of their health, live well, and get screened early. In China, the detection rate of breast cancer through screening has been persistently low. Only 5.2% of cases are discovered through regular checkups. 82.1% of women are diagnosed only after symptoms appear. Now, smart technology is helping providers offer early breast and cervical cancer screenings, meeting the public's need for proactive healthcare.
Artificial intelligence and cloud computing are two of the most significant innovative technologies of the last decade. Because the cloud possesses immense computational power, we can perform calculations that were impossible for a single or even a few local servers to handle in the past. Much of our AI processing and data storage is now done in the cloud. What this allows us to do is shift tasks that would traditionally require local processing or storage on an end-user device, a terminal, and move them to the cloud instead. This, in turn, lowers the technical requirements for the terminal device. When the device's requirements are lower, its cost decreases and its operational stability improves. This is what enables large-scale deployment. So, this combination truly represents the ideal solution.
Breast cancer is the leading malignant tumor that harms women's physical and mental well-being, and the number of cases in China is rising year after year. To tackle this, iCare 365's Dr. J has launched AI ultrasound screenings. In Guangdong, Jiangsu, Shandong, Hubei, and Guizhou, hundreds of thousands of women have benefited, with 60,000 more to be screened this year.
A single one of our devices can screen between 100 to 150 people a day, so the workload is quite significant.
In the past, our work was mainly focused on publicity campaigns, trying to influence people's mindset, because our community centers just didn't have this kind of capacity. Early screenings had to be done by sonographers from the hospitals. Now, with Dr. J, we're more proactive. After training, we can enter grassroots communities directly, improving efficiency, coverage, and patient compliance. Terminal data also shows a clear rise in detection rates.
In traditional breast screening, it's relied on sonographers. But in China, we simply don't have a large enough number of sonographers to achieve full screening coverage. What our Dr. J has done is embed the expertise of these sonographers directly into our AI product. This allows frontline staff like nurses, technicians, and even medical students to conduct the screenings. Based on the principles of deep learning, a cutting-edge technology, we've essentially encoded the knowledge and expertise of a human sonographer into our AI product. This means that right there on the front lines, we have an AI doctor analyzing the ultrasound video in real time and making an assessment.
By accelerating the adoption of new screening technologies like big data, AI, and 5 grams, technological innovation could elevate the overall standards of cancer screening. This reduces the burden on primary care centers, improving their efficiency and services. iCare 365 is driving impact through smart technology.
When we scan, the pressure must be even. Look at the image. Uneven pressure shows clearly. AI is reshaping traditional medical workflows. In ultrasound, it expands applications and strengthens quality control. Cloud-based systems help standardize operations and boost diagnostic accuracy. On another front, AI reduces the pressure of training and work, helping nurses and technicians evolve into multi-skilled professionals. It encourages doctors to embrace the future of digital information, which helps maximize the value of all physicians, especially the top experts.
The AI-powered breast cancer early screening robot, developed by a Care 365's R&D team, uses artificial intelligence to automatically detect and flag lesions, classify them, calculate their size, and determine if they are benign or malignant. This enables low-cost, efficient screening for all, while supporting data-driven breast cancer risk assessment by region.
How do we train an AI breast cancer screening robot? First, it has to learn from massive amounts of breast cancer data. Our company has its own teams of breast cancer specialists and algorithm engineers. These two interdisciplinary teams work together to feed this data to our AI robot. Through deep learning, it masters the ability to identify the characteristics of breast cancer in ultrasound videos. Once the robot passes our evaluation, it's ready to analyze imaging data for these features in real time. When it detects a potential cancer, it's able to flag it.
In the last session, we covered the basic theory of the Dr. J and how it can automatically identify lesions.
The Dr. J AI ultrasound project for breast cancer screening began in early 2014. Working with breast health departments nationwide, we trained our neural network on over 300,000 clinical cases and completed hundreds of system upgrades.
Performing a single ultrasound screening for breast cancer involves analyzing thousands, even tens of thousands of video frames in real time to produce a result. This places an enormous demand on computing power. On the other hand, screenings often need to be conducted on the front lines, in grassroots communities out in the field. This creates high demand for portability and a small form factor. Consequently, there are significant challenges for the overall solution's power consumption and stability. With support from Intel, we arrived at our current solution. The AI workload for image recognition was migrated from dedicated GPU resources to the new generation of Intel Core processors with integrated Intel graphics. This achieved a crucial balance between power consumption, performance, and the physical size of the ultrasound device.
In this era of digital transformation, advancing technologies like 5 grams and smart edge computing are unlocking more possibilities for innovation and widespread application in healthcare. Technology-assisted medicine will continue to improve the quality and efficiency of medical services, benefiting more people and enhancing their overall well-being and quality of life.